talk a little bit about this healthcare idea. What does that mean? How does this sort of a data explosion change the healthcare business?
Well, first, if you look at the friction, I think if Steve Jobs looked at healthcare, which is one of the things he wanted to do, is you look at the friction of the insurance company, friction of doctors, friction of traveling to doctors, and the benefit you actually get out of visiting your GP every year is almost zero. Yeah. A totally digital system would bring you 1,000 times more benefits at 1% of the cost, maybe even free. So it gets so inexpensive, you could provide a lot more healthcare free of charge by taking out these antiquated systems.
There's a wonderful book by Eric Topol called The Patient Will See You, which precisely talks about, how ridiculous and antiquated annual physical.
And we may actually, our next Futurecast may be at the foundry in Houston, which focuses on healthcare. But talk about the exchange, because on the one hand, of course, there's nothing we're more sensitive about than our health data. The last thing we want is to broadcast to the world what ails us. But on the other hand, I assume in terms of this exchange, it's one of the most compelling ways to convince consumers that a post-privacy age can work for them.
Going back to what he said, there's no privacy. And certainly your healthcare is not private, because now you
But people think their healthcare is private.
Artificial intelligence can read your emails and find out if you're insecure or you have a narcissistic complex. I mean, there's a lot more we're going to know about you just by going to the drugstore.